Well, hello, my name is Dr. David Hartz, and I want to welcome you to this seminar on chronic fatigue. Now, what we're going to be covering during this seminar is some of the underlying causes of chronic fatigue. Um, you know, this particular subject is so widespread, and our whole population within America and throughout the world has become so used to being fatigued that we have developed whole series of different products to keep us energized, and we're running on coffee. And in some cases, I get referrals of patients from major healthcare clinics that are actually just giving people stimulants to keep going, which is kind of like running a car on grain alcohol. After a while, it go real fast for a while, but after a while, it's going to burn up the valves in the engine. And that's what's happening to people each and every single day because they're taking synthetics, they're taking medications just to drive themselves. And we're supposed to be naturally healthy and we're supposed to have natural energy. And when we don't, the smart thing is to try to figure out why we don't have normal energy, why we don't feel good. And this can happen all the way and feel well all the way into late in age. A lot of times we think, we don't feel good because we're a little bit older than we used to be. Well, there are people that are in their 90s and 100s that still have vibrant health. And I believe that's still possible, but we have to be able to push down and have technologies that find out exactly what's going on. Now, let me break this down. There's about 3 different levels of chronic fatigue syndrome that we need to talk about. The first one is the mild cases. You can care for yourself. You can do light domestic, duties, but it's kind of difficult. You're able to maybe do your job, but you maybe take days off because of fatigue. It may not totally stop your leisure activity, but it does affect it, and you have to take rests and maybe sleep. The moderate cases is when you notice your mobility and you're restricted in most activities of daily living. The levels of ability, severe symptoms often, varies from time to time, peaks and troughs. You're likely to have stopped work at this point and require rest periods. Sleep at night tends to be poor or disturbed. And then we get to the severe cases, which aren't that frequent, but I have treated many of these folks. You're able to carry out only minimal daily tasks such as washing, and cleaning your teeth. I had one lady who spent, 2 or 3 people actually, and they're all females, that actually spent years in bed and only got out of bed for 2 or 3 hours a day just to make food and get back into bed, and stayed that way for years and years and years and years. So this can be extremely debilitating. It can really affect your life. And most people aren't in the severe case, but there are many that are. And it can be severe or just be very irritating and very disruptive of your daily life. Now, some additional symptoms of CFS is persistent fatigue, not relieved by rest or unfinished sleep, poor memory or concentration, a sore throat, large lymph nodes, myalgia or muscle pain, stiff jointness and pain without swelling or redness, and extreme exhaustion that lasts more than 24 hours following mental or physical exercise, even mental exercise. When you get concentration over a long period of time, a lot of stress on you, if it really wears you out, these are symptoms of chronic fatigue syndrome. And the good news is we're going to be going through this, is there are ways to handle this naturally. Now, the 9 causes of fatigue, we see immune challenges, thyroid, metabolism dysfunctions, adrenal dysfunction, dehydration, anemia, sleep dysfunction, hormonal dysfunction, inflammation. And we're going to cover and go through each one of these, and is somewhat briefly, but we're going to give you a good feeling of what can cause chronic fatigue, not just you're just tired, you need to take this drug. We've got to figure out what is doing this. Now, let's talk about the first one. Most people don't realize that your body, when you think about infections, most people think of acute infection, where you get sick with a virus, you get a cold, or you get the coronavirus, or you get something where you get very, very sick. And that certainly is an acute infection with bacteria, fungus, and with parasites. And that's what most people are really familiar with. But there's another type of infection. It's a chronic infection that gets into your system, and you never get deathly sick from it, but you never get over it. And it just stays in your system, affecting your autonomic nervous system, affecting your overall immunity, and it can also produce, as we're going to find out, autoimmune disease. And these particular infections can stay years and years and years and years. Many people say, and I come in and when we do a timeline consultation, which we go all the way back to birth, and many times you can find really underlying causes by doing a very good history. But when you do a good history, you can find many cases with these folks where they got sick and then they just never got better. They got sick and then just never seemed to get over it. And this is very, very common. So you got to dig down to see if you can find chronic infections, and you got to have technologies to find that, because there isn't, sometimes will show up on just normal blood testing. It just will not show up. The body is compensated to it. And also in standardized medicine, they're looking for extremely out of normal ranges with infections. They want, white blood counts up in the 20,000s and stuff for people to say they have infections. And when you have infections for a long period of time, even with bacteria, it will cause your white blood count to be suppressed over a long period of time, not elevated. So you have to be looking for it for chronic infections, which standardized medicine just doesn't address. They're not concerned about chronic. It's just not their bailiwick. It's ours in alternative and integrative and functional medicine. Now, viruses is one of these culprits. We got the human cytomegalovirus, Epstein-Barr, there's zillions of these things. Herpes simplex, hepatitis, we're seeing that now where they're finally coming along getting vaccines to get rid of hepatitis C. And now they're always, you won't hear about this really until they have something to sell you and to give you to take for it. All of a sudden they got a vaccine for that, so now everybody's advertising Hep C. Well, there's people living that thing for years and years and years, and we find it in people all the time and have found chronic infections in people for years. But they don't do anything about it until it gets terribly, terribly bad, or it causes other symptoms, and then people never know what the original cause was. But these viruses can stick around your systems for years, and listen, there's so much research that chronic viral infection causes cancer. It's contributing to numerous other types of syndromes, and it certainly can upregulate your nervous system, also affect chronic fatigue. It forces your body into a autonomic state where your body's constantly trying to heal, which we'll talk about. Mold and fungus. Here's an example of some testing which was done of the brain, which shows fungus right in the brain itself. And this absolutely can happen. You can get mold that crosses the blood-brain barrier and get established in the brain. And of course, in Florida, where we practice here, you get all types of chronic mold in houses with black mold and all throughout the country, actually. And this can be a really serious problem, and you have to be able to track it down. Chronic bacterial infections, we see Lyme's is much more widespread than people ever thought it was. The mycoplasms, the chlamydias, and many, many, many others. Just literally hundreds and thousands of different types of bacterial infections. And sometimes it's just not one. Sometimes it's a combination of all of these, or a combination of one or two. Because once you get a immune system suppressed by a chronic infection, then other types of microbes, of viral, fungus, viruses can come in and set up shop in your body. A lot of times they don't want to kill you, not right off the bat, but they want some place to live. And they can, even the funguses can actually suppress the immune system, actually make a place for themselves, which of course also, like we said, make a place for a lot of others. Parasites, people normally think about parasites being really like worms and stuff in them, and that does happen even in America, but most of the time it's unicellulars or small ones, but we have found definitely large parasites we've actually eliminated out of people. And this can happen, and we can get it here in America, and we can get it from other countries also. Let's talk about thyroid dysfunction just for a second, because there's so many people who get testing done on the thyroid, and they say that they're normal because they're TSH, the thyroid stimulating hormone, which is usually the one thing that they tested. Now, I've been doing this stuff for 20 years, and when we first started this, even in Tallahassee, Florida, there wasn't anybody testing the thyroid. They were all doing TSHs. Nobody was testing any of the factors of T4 and T3 and free T3, free T4, reverse T3, all the other factors that you can do. And they were missing things. And we were one of, I think, the first people in this town to actually test anybody for anything else besides that. I got so many strange looks about what is he doing over there and why is he doing that? Does it make any difference? Well, it does. And we're going to see that the thyroid symptoms can cause every bit of the slowed metabolism of chronic fatigue syndrome, and it can affect your entire system by decreased mental processes, cholesterol problems, need for vitamins, loose skin, dry hair, dry skin, sleepiness, depression, and fatigue, decreased libido, inflammation of tendons and joints. You can see this is all stuff that you can fit right into chronic fatigue, but also unique to the thyroid deficient patient also. And this happens so frequently because if your TSH is normal, your thyroid stimulating hormone is normal, they think that you're fine, and that's just not the case. And here's, I can show you what I mean. We have the hypothalamus that produces thyroid hormone that is called thyroid regulating hormone that actually stimulates TSH in the pituitary. And then the thyroid stimulating hormone actually produces T4 in the thyroid. As you can see how those arrows are going down this way, okay? And we see that T4 is being produced in the thyroid, but then the liver and throughout the tissues of your body, it's broken from T4 and converted into T3. And then the T3 is what's utilized at your target tissues, your heart, your brain, your muscle, your bone. And this is where your metabolism actually is powered from. It's powered from the T3 factor. Now, this is the problem. Guess what? If we're measuring TSH and it's normal, they're assuming, and we're even measuring T4, it could be normal, but if it's not being converted to T3, then you're deficient at the cellular level. And so if you're not measuring this, and this is what nobody measured forever and ever and ever, until people started realizing that there can be conversion problems. Now, the problem with this in medicine is that this conversion occurs out here in the body in tissues, kidneys, different tissues, the fat, all throughout the entire body, and the liver. And standardized medicine has no way to help that because it can be caused by numerous factors, which we're going to talk about. The only thing that they do is they supply you with T4, Synthroid, other types of levothyroxine type of medications. But the problem is they can give you all the T4, this level will be totally normal. If you're not converting to T3, you're still going to feel terrible. And that's the problem. So when we measure it functionally, we measure T4, we measure T3, and then you got to measure the free T3, which is another type of T3 and T4 that's actually what actually transfers in by a globulin to the tissue level. It actually, you have to measure that too because it's got to be conversion to that. And there can be problems in this conversion all the way along before we get to the tissue. And so it's not as simple as TSH. You got to be able to do other factors to be sure it's getting to the tissue levels. Now, so the conversion of 4, we see low pituitary function, inflammation, toxicity, low thyroid function, we can see autoimmune, low thyroid activation, liver toxicity, digestive problems, inflammation, and high stress hormones, high estrogen. All these things can affect the conversion of T4 to T3. And therefore, you got to track these things down if you're going to try to get people better, not just try to drive it from the T4 side. And that's what they'll end up doing is they just keep driving it from the T4 side till they get your TSH normal. And listen, you can have a TSH that's off the chart and your T3s in the body be totally normal. They do not always go together in any way, shape, or form. And so there is an awful lot of interrelationship of the different factors of the T4, T3, and active so forth, and slow metabolism. And so this will affect cortisone, anemia, and heavy metals. Your blood sugar levels are all interrelated in this whole TSH, thyroid, pituitary, adrenal axis, they call this, which can all be interrelated together. Now, let me just talk about glucose metabolism as far as this chronic fatigue syndrome, because you can get fatigue can develop by ATP depletion by byproducts of metabolism accumulated in the muscles. And therefore, you can get low blood glucose, which can affect the central nervous system and cause you to be very, very tired. And so if you start to get insulin resistance, you will get less sugar being transferred into your cells. And if that occurs, then your ATP levels drop, and therefore your metabolism drops, and you will get tired. So what a precursor of diabetes is low blood sugar, and then if it stays that way long enough with your body being pelted with the insulin, which is called hyperinsulinism, then after a while your cells become resistant to that insulin, and then your blood glucose increases. But in the beginning stages, you can get fatigue from low blood sugar, and later on, by the way, from diabetes, you can get fatigue too, because it still is not getting into the cells. So blood sugar, real consistently high carbohydrate intake over several years can definitely affect this. Then you see the blood sugar responses here. We get the high blood sugar levels that go up, and then they drop low. The stable blood sugar level line should be right along this elbow, but you get these big swings going up and down. You can definitely affect some fatigue during these downswings. If you do start feeling a little energy increase once you eat, then you probably have got some sugar handling problems that are going on. And that is fixed by you staying away from the carbs and getting your body, your insulin resistance at the cellular level, cellular receptor level better. And this can be helped by intermittent fasting and just a real low carb diet with some good healthy fats and some veggies and some good protein. Now, here we go with the insulin. Once again, you're supposed to be nice and level, and we have a big roller coaster going up and down, okay? We don't want that. This beats the tar out of your body, also beats your brain up. It does all kinds of injury throughout the entire tissues of your body, so we got to keep blood levels normal. Now, adrenal fatigue is an adrenal gland that sits right on top of your kidneys. It puts out norepinephrine and different catecholamines that actually power your autonomics and really the sympathetic side of your nervous system. Over prolonged stress and even some chemical exhaustion which can occur, these adrenal glands in the beginning become hyperreactive, a little bit like the pancreas and the insulin, and then over a period of time they become fatigued. And you'll notice that with sometimes with postural hypertension, when you stand up real quick, you might get a little lightheaded because your blood pressure will drop, and it can be also picked up by taking blood pressure and lying down and staying in that position really fast, and your systolic pressure will drop considerably if you do have that. And we see adrenal dysfunction going like this. We get a decreased resistance to stress stage, and then we get a hyper-resistance, a hyperadrenal function, and then we get a decreased resistance over a period of time. And this is kind of different stages that occur. We get the pre-chronic stage, the stage of alarm, the resistance, and then the exhaustion. And you can be in anywhere in this phase. In this area in here, you don't get too much fatigue. When you start getting into here, you will get fatigue. And so adrenal function is also extremely important in evaluating your energy levels. So how can I tell if my adrenals are fatigued? You may be experiencing adrenal fatigue if you regularly notice one or more of the following things. If you're tired by no reason, you're just tired. If you're trouble getting up in the morning or even when you go to bed at a reasonable hour, if you're feeling run down or overwhelmed, if you have difficult bouncing back from stress or illness, or you crave salty or sweet snacks, feel more awake, alert, and energetic after 6 p.m. than you do all day long, or you get lightheaded when you rise up quickly, like I mentioned. These are some indicators. We have ways with testing as well as energetic testing, and we can figure this out in the office very, very well as all these different causes actually. But these are some things you can get an idea. Dehydration, people forget about this. We're really, really in need of hydration with all the caffeine and energy drinks and things that are actually stimulating our body, but are diuretics that pump water out. Alcohol, you should drink as much in the volume of whatever alcohol you drink in regular water, because you're going to be at least half of it anyway, because you're going to be dumping out a large amount of the fluid that you're taking in because of the diuretic effect of the alcohol as well as the caffeine. So This is extremely important because it can affect fatigue, headaches, brain fog, dry skin, pain, and joint pain too. You'd be surprised how much you hurt when you get dehydrated and you don't have enough lubrication to your joints. So this hydration is really important. Your body's 70% water. You know, people forget this, but when you get dehydrated, it does not function well, being 70%, needing that kind of fluid intake. Now, Institution of Medicine determined that an adequate intake was about 3 liters, about 13 cups of total beverages today. That's about 9 cups for women. Drink at least 8 ounces of glasses of fluid or water per day because all fluids count towards total. It does, but like I said, if you have a diuretic effect in alcohol or caffeine, you got to compensate for that. Okay. The hydration test you can do, which does work pretty well, is you can pinch the skin on the back of your hand. If you see a little turgor or just a little, holding up of the skin and lack of it to go back to flexibility, then you could definitely be dehydrated and you need to be hydrating yourself. It's a little way you can do that. Another thing can happen is toxic burden as far as chronic fatigue syndrome is toxicity in the body. There's no doubt that this does it. We got aluminum, mercury, lead, nickel, silver, all these heavy metals and toxic chemicals, the pesticides, the petrochemicals, preservatives, flavor enhancers. These are all in our foods. And the problem with this is that these cause inflammation in the body. They do stress adrenal function. They can affect even your blood sugar levels. You'd be surprised what this toxicity can do in disrupting normal function. And of course, then we're taking medications and everything on top of trying to get better, and it just causes the body burden, the toxic body burden, to even get worse. And so you got to be able to evaluate your toxic load in your body and actually decrease it. That's why it takes somebody to kind of help you with this. You can do some of it if you just want to do fast and stuff like that. Intermittent fasting does help. But these chemicals and specific chemicals come out with specific different types of detoxification agents. And without them, it's very hard to get yourself really, really detox. So you do need some help, and it needs to be done correctly, because if you dump this stuff the wrong way, it can go into your system and go into brain and different places. So it's probably something you need a little professional help with. We do see, though, endocrine changes in patients with acute organophosphate poisoning, and we can see that it changes hormonal function. We can see it can affect thyroid function. Just to give you an example, there's all kinds of different studies on this that show that toxicity affects hormonal, diabetes, the HPA axis, numerous different things. We can see also anemia. So we get normal red blood cells, and then we get anemic. We get much less red blood cells. Of course, red blood cells are transporting our oxygen, and they have hemoglobin in them. And with anemias, and this does happen, you can get chronic fatigue. I've seen so many patients never really check for this because their red blood count's okay, their iron might be okay. But there's other specific tests that we need to run, like ferritin and a bunch of other ones, which will give us better ideas of that. Now, let me just real quickly talk about the difference between functional, and we're almost done, versus pathological blood test normals. The reason we do what we call functional normals is that standardized tests have large normals, okay? They go from all the way out here to all the way over here, all right? And they can be gigantic. And these normals have gotten bigger and bigger and bigger and bigger. This is the reason people can have lab tests. They can tell them that they're normal and they still feel sick. It's because these normals are so large. So what we do is we narrow the normals down, and you can see on this next one, we take these normals and make them much narrower. So the functional low and high is here, abnormal highs and lows are way over here, but the functional range we want is in here. And I've seen this happen through the years. The normals are getting wider and wider. It's kind of like they're saying that if everybody feels bad, then that's fine, as long as we all feel bad together. We've got to be all feeling bad together, and that's just not good. The body wants to be normal. It doesn't want to just be average. In fact, how they get most of these normals, they put you on a big bell curve, and if wherever the bell curve of everybody falls, whatever average is normal. Well, what if the whole bell curve, everybody gets sicker? It means that everybody's getting sicker. It doesn't mean that you're normal, okay? And that's what's happened. And so even with thyroid function, we see that the same way. So we use functional lab ranges, which are much more narrow. Subclinical anemia can be iron deficiency anemia, B12 deficiencies, decreased erythropoietin production, which is not too common, but it does happen. Latent hypothyroidism, we talked about that. That can affect anemia. Toxicity, heavy metals, and chronic and toxic chemicals. These toxicities can affect actually anemia and it affects all the way down to the bone marrow. And the fact is where a lot of these heavy metals are deposited is in the bone marrow. It will affect your ability to produce normal blood cells and to be able to fill them with normal hemoglobin and therefore transfers oxygen. Now, sleep dysfunction, I'm going to mention this as closing here, that sleep is huge. If you're not falling asleep or if you can't stay asleep and you're not getting at least 8 hours, 7 to 8 hours of good, deep REM sleep, you're going to be tired. And it's going to show up in the afternoon, usually around 3 o'clock, 4 o'clock, and you have to take naps. You're going to be really, really sleepy. And then you may get a second wind within about 7, 8 o'clock at night. You start to get, all of a sudden, right when you want to go to bed, you're starting to feel better. And sleep apnea is extremely big with this. You may be getting periods at night where you're getting airflow restrictions in your nose and your throat from snoring and so forth, and it's restricting your oxygen intake. And when that happens, you go into a sympathetic mode. In other words, your fight and flight mechanism or survival is going all night long, thinking you're going to suffocate. So you never go into a deep parasympathetic REM sleep. And when you don't, you can't actually regenerate. And when you get up the next day, you're tired. Causing insomnia can be blood sugar metabolism, adrenal dysfunction, toxic hypothalamus medications, and some of the sleep apnea that I just mentioned. Hormone dysfunction, low testosterone, female hormone dysregulation, these are all huge. Needs to be checked. As once again, this is not just a stimulant answer for this problem. It's you got to reach down and try to find out what the underlying causes of these problems are. And these can be helped. Many times they can be helped naturally. Inflammation is a major silent killer in our bodies, and inflammation from these receptors are huge. There's little receptors around our cell membranes, and everything that goes into our cells have to go through these receptors. When we end up getting inflammation, it affects the ability of these receptors to allow things into our cells, like glucose, like enzymes, like almost like T3, T4 for our thyroid. Everything has to go through these receptors into our cells. If it sits out here and measures, your T4 measures fine, or your T3 even measures fine, if it doesn't get inside the cell, it doesn't help you. And so that's why a lot of problems occur in that we get normal blood levels, but they don't get into the cells. And a lot of this is from inflammation that occurs. Inflammation, as you can see, causes numerous different problems as well as chronic fatigue, and it has to be addressed. Now, the difference we're talking about in functional medicine is in standardized medicine, they're dealing with symptoms. They want to know major disease processes, okay? And they're looking for fatigue up here. They're looking at your symptom is fatigue. I have a pharmaceutical that will energize you and stimulate you. We got energy drinks. You take it. You got cancer. We'll cut it out, and we'll kill that cancer. You got heart disease. We'll try to unplug the artery that's got plugged up and save your life, which is all good stuff. This is not bad. You need to be doing it, except for this. We don't want them to do it that way. But it's the underlying causes. So you got this iceberg, and we keep treating the upper tip of it out of the water, and there's this big old gigantic, underlying iceberg just underneath the level of the water. And if we don't look at some of these problems and try to treat them, we do not get to the true cause of disease, okay? That's the problem. So chronic fatigue, major problem, but I've treated so many people with this. It's doable. It takes a little work to figure out, and you got to have some technologies to figure this out. But I had people that have been in bed for 7 years get out and ride a bicycle 23 miles, all right? Took maybe 9 months to get them back up again. I've had people laying in bed for years and just totally fatigued and come back to normal life and be able to live and enjoy their grandchildren and get up and go again. It definitely happens. Now, what do we do in our office? We do a comprehensive, we call it design clinical nutrition, and it's really designed nutrition systems that I actually have developed and teach to doctors. And it's a whole system evaluation that uses biophoton physics at some of the highest levels, as well as functional medicine and laboratory analysis. We have a 26-page comprehensive timeline history. We got heart variability testing that we use to give us to know whether or not you're stuck in an autonomic, or we call sympathetic or parasympathetic state. We do body mass analysis. Of course, we do blood pressure analysis of your adrenals, lying down and standing up, meta-oxy testing, temperature extremities, or complete system neurological, kinesiological biofeedback exam, which we actually measure the biophoton emission from your body, and we explain all of this, all the research behind it. It's really exciting stuff, and it works really, really well. We do a comprehensive report of findings for all this and recommendations for care. And of course, we do functional blood testing. We have ways to do this blood testing. People always want to know if it can be covered under insurance. We get it so inexpensive. For almost $100, I can get you $600 worth of blood tests and a functional report. And we don't even make any money on the blood testing because we just want to get the information for you. So this is very inexpensive compared to medicine, this day at least. We want to make it available for families and people, so we've kept the price, the whole system, even the treatment is not, it's amazingly inexpensive and affordable for most folks. So, okay, now this is how you can get an appointment with us. First of all, you can call 850-933-5616. That's my personal number, and this will be an appointment that you can get with me. I will either talk to you, or you will get a receptionist that will schedule an appointment. And also, which would be probably even a better idea, is to go to drDhartz.com, which is probably where you're at right now if you're watching this video. And go ahead, and there's a tab there for making a no-charge 15-minute phone consultation with me, and you can just kind of register an appointment and put your telephone number in there, and I will call you. And we can talk for, a short period of time and see a little bit about your history and what you're dealing with, so I can be sure this is right for you and match up the treatment that we have, because we want to be sure that we get really, really good results and that I'm not wasting your time or mine. So we can do that, and I'll be happy to do that for you. Or if you do come in and make an appointment, come in and we don't talk to you, if for some reason on our consultation I figure I feel that I cannot help you, I will certainly tell you at that point, and there would be no charge for that consultation to that point. I wouldn't charge you for not being able to help you. So, but anyway, please do that, either one of those two different methods, and we can see whether we can get you some energy back and get to the underlying causes. Chronic fatigue there's reasons for this, and the fatigue might be the worst. It might be the worst problem to you, but it may not be the worst problem to your body. There might be things that are causing this that are much more detrimental to you than even just the loss of energy. And so we need to figure this out, and we need to get you back feeling good. So we look forward to seeing you, and God bless.